I'm Dr. Leonard Brooks, cardiologist. If you're over 60 or getting close to it, I need you to hear me out right now. Every single day in my practice, I see the consequences of a problem that gives no warning, a silent enemy that works in the shadows, and it could be affecting you at this very moment without you even knowing it. I'm talking about your arteries, hardening and clogging up over time. Have you ever felt your legs heavy as lead by the end of the day? Do you find yourself short of breath climbing a flight of stairs that used to be no problem? Do you notice a strange tingling in your hands and feet, or find they're always cold, even in warm weather? Listen closely. Those are not just normal signs of aging. Those are distress signals from your circulatory system. People ask me all the time, Dr. Brooks, what can I take to clean out my veins? They're searching for a magic pill. And while medicine has come a long way, the most powerful answer I've found in my years of practice comes from nature, from one very specific vitamin that I like to call the plumber of your vascular system, a vitamin that science has shown can help guide dangerous waste products away from your arteries. But I want to be completely honest with you from the start. I'd be misleading you if I said it's just one thing. The truth is, it's a team of 4 key nutrients working together in perfect harmony. In this video, I'm going to reveal the star vitamin, the one I consider absolutely essential, but I'll also introduce you to its 3 critical partners, and I'll explain everything in plain English, no medical jargon, so you understand how each one works, what the science says, and how you can start using them in your daily life. I'm asking you to stay with me all the way to the end, because the last nutrient I'll mention is the one almost everyone overlooks, and not knowing about it is one of the most common mistakes I see in my patients. I'll also reveal some hidden saboteurs that might be in your home right now, including very common medications that could be quietly undermining everything you're trying to do for your vein health. This information is too important to miss. Let's get started. Before we talk solutions, it's critical you understand what's actually happening inside your body. Think of your circulatory system like the plumbing in a house. When the house is brand new, water flows strong and free. But over the years, scale, grease, and mineral deposits start sticking to the inside of those pipes. They get narrower, stiffer, and the flow drops to a trickle. That is essentially what's happening to your arteries. This process is called atherosclerosis, and it's the leading cause of most heart disease. The plaque that accumulates, that scale inside your arteries, is a sticky mixture of bad cholesterol, LDL, fats, cellular waste, and a key component we'll talk about a lot today, calcium. When plaque builds up, 3 very dangerous things happen. First, your arteries stiffen. This is known as arteriosclerosis. Think about a new garden hose. Flexible and elastic. Now picture that same hose left out in the sun for years. It turns hard and brittle. Bend it, and it cracks. That's what happens to your arteries. They lose their ability to expand and contract with each heartbeat. This stiffness is one of the primary drivers of high blood pressure. Your heart has to pump far harder to push blood through those rigid tubes, and that constant pressure damages not just the arteries themselves, but vital organs like your kidneys and your brain. Second, blood flow decreases. As plaque grows inward, the channel for blood narrows. It's like trying to water your garden through a hose someone is standing on. The amount of oxygen-rich blood reaching your organs becomes insufficient. The result? You feel bone-deep exhaustion that doesn't go away even after 8 hours of sleep. Your calves ache when you walk, what doctors call intermittent claudication, forcing you to stop and rest. Your hands and feet stay cold because warm blood can't reach them properly. Your brain feels it too, leaving you foggy, struggling to concentrate, or forgetting things more easily. In men, one of the earliest warning signs is often erectile dysfunction. Third, and most serious of all, the risk of clots and catastrophe rises dramatically. That plaque isn't a smooth, stable layer. It's often unstable, like a volcano ready to blow. If a piece breaks off, the body responds the same way it would to any wound, by forming a clot to seal the damage. But inside an already narrowed artery, that clot can completely block blood flow. If it happens in a coronary artery, it's a heart attack. If it happens in an artery leading to the brain, it's a stroke. That's why this is called a silent killer. There may be no symptoms at all until it's too late. So when we talk about unclogging your veins, we're not talking about some literal drain cleaner. We're talking about a smart, science-based strategy to help prevent this plaque from forming in the first place, to keep existing plaque stable, and to give your body the tools it needs to keep those pipelines as flexible and clear as possible. And this is exactly where our first and most important vitamin comes in. Now that we understand the problem, let's talk about the star solution, the vitamin that in my view is the most revolutionary and most overlooked nutrient in cardiovascular health. I'm talking about vitamin K2. Don't confuse it with K1, which is found in leafy green vegetables and handles blood clotting. K2 is different. It has a very specific mission. It is the traffic cop of calcium in your body. Here's what I call the calcium paradox. On one hand, we tell people, especially women after menopause, to take calcium for strong bones. But on the other hand, I just told you that calcium is a major building block of the plaque that clogs your arteries. So is calcium good or bad? The answer is, it depends on where it ends up. Calcium is like a guest at a party. If it's in the ballroom, your bones, great, it strengthens the structure. But if it wanders into the engine room, your arteries, it can cause serious damage. This is where vitamin K2 steps in. Inside your body, there are special proteins that transport calcium. The two most important are osteocalcin, which helps bind calcium into your bones, and matrix GLA protein, MGP, whose job is to prevent calcium from sticking to the walls of your arteries. But here's the catch. These proteins are born inactive. They need something to switch them on, and vitamin K2 is that switch. When you have enough K2, it activates the MGP protein. Think of activated MGP as a small army of sweepers patrolling your bloodstream. When they encounter a calcium molecule somewhere it shouldn't be, they grab it, remove it from the arterial wall, and redirect it where it's actually needed, your bones and teeth. So, K2 doesn't just help keep your arteries flexible, it also helps strengthen your skeleton. A double protective function that is simply remarkable. Now you might be thinking, Dr. Brooks, that sounds great, but where's the proof? The evidence is strong. The most compelling data comes from a large, well-respected study called the Rotterdam Study. It followed nearly 5,000 people in the Netherlands over 10 years. The findings were striking. People who consumed the most vitamin K2 in their diet had up to 50% lower risk of severe arterial calcification and a similar reduction in risk of dying from cardiovascular disease compared to those who consumed the least. Now, I want to be crystal clear here. This was an observational study, meaning it shows a strong association, not a direct cause and effect relationship. We cannot claim that K2 reverses existing calcification. The research on that is still ongoing, but the data strongly suggests it plays a key preventive role in keeping calcium out of places it doesn't belong. There are two main forms of K2, MK4 and MK7. Both are useful, but the science increasingly favors MK7. The reason is staying power. While MK4 remains active in the body for only a few hours, MK7 can keep working for more than 72 hours, giving it far more time to activate those protective proteins. How do you get more K2 through food? The richest source in the world is a Japanese fermented soybean dish called natto, but its taste and texture aren't for everyone. Other good sources include certain aged cheeses like Gouda and Brie, goose or chicken liver, and egg yolks from pasture-raised hens. Since it's difficult to get therapeutic amounts from diet alone, supplementation is a very reasonable option. Doses used in most cardiovascular studies range from 100 to 200 micrograms mcg per day of the MK7 form. But here is a critical warning. Please pay close attention. If you take blood thinners like warfarin, Coumadin, or acinocumarol, you must not start taking vitamin K supplements on your own. These medications work precisely by blocking vitamin K. A sudden increase could interfere with their effect. Any change must be discussed with and supervised by your doctor. The golden rule, one I never break, is this. Always, without exception, talk to your doctor before adding any new supplement, especially something as powerful as K2. If K2 is the traffic director, then vitamin E is the personal bodyguard of your blood vessel walls. Its superpower is being a potent antioxidant. Here's how to picture it. Tiny troublemakers called free radicals circulate through your body. They're unstable molecules produced by everyday living, but also by pollution, cigarette smoke, and chronic stress. These free radicals act like sparks, constantly bombarding the inner walls of your arteries. This bombardment causes damage called oxidative stress, triggering inflammation in the inner lining of your blood vessels. That inflammation is like creating a rough, sticky surface on the inside of your pipes, the perfect place for cholesterol to oxidize, stick, and begin forming plaque. Vitamin E acts like a firefighter, snuffing out those sparks before they start a fire, keeping your arterial walls smooth and healthy. Vitamin E also has another trick up its sleeve. It helps keep your blood less sticky. We have cells in our blood called platelets, whose job is to clump together and form clots when you cut yourself. But sometimes they become overactive and clump together without any wound, creating dangerous clots inside blood vessels. Vitamin E has a natural, mild antiplatelet effect. And I want to be very clear on this point. Vitamin E's effect here is modest. It should never, under any circumstances, be considered a substitute for medications like aspirin or clopidogrel, Plavix. If your doctor has prescribed those, think of vitamin E as an added layer of protection, not a replacement. The science supports its benefits. A major study, the Women's Health Study, followed nearly 40,000 women and found that those who supplemented with vitamin E had a 21% lower risk of developing deep vein thrombosis, blood clots in the legs. In women with an already high genetic risk, that reduction was even more impressive, approaching 50%. The best food sources of vitamin E are healthy fats, nuts, especially almonds, sunflower and pumpkin seeds, avocados, and oils like olive oil. When choosing a supplement, look for products containing mixed tocopherols, as they provide a more complete spectrum of activity. As always, and especially if you're on blood-thinning medications, consult your doctor before adding a vitamin E supplement. We've talked about directing traffic and protecting the walls, but what are those walls actually made of? That's where vitamin C comes in. We often think of it only for fighting colds, but its role in vascular health is fundamental. Vitamin C is the cement of your circulatory system. Its primary function here is that it is absolutely essential for producing collagen. Collagen is the protein that gives structure and strength to almost everything in your body, your skin, your bones, and yes, your veins and arteries. Without enough vitamin C, your body cannot manufacture quality collagen. Imagine building a brick wall without mortar. The structure would be weak and crumble. That's what happens to your blood vessels without adequate vitamin C. The walls of your veins, especially in your legs, weaken and dilate. Blood pools, pressure builds, and painful varicose veins develop. Beyond collagen, vitamin C is also a powerful antioxidant that works in tandem with vitamin E, and it performs another vital function. It protects and recycles a molecule called nitric oxide. Nitric oxide is a natural signal that tells your arteries to relax and open up, which helps lower blood pressure. Vitamin C preserves it, extending its beneficial effect. Unlike K2 and E, vitamin C is water-soluble. Your body doesn't store it. You need a fresh supply every single day. Fortunately, it's easy to find in food, citrus fruits of course, but also red bell peppers, kiwis, strawberries, and broccoli, which often contain more vitamin C per serving than an orange. For a therapeutic vascular effect, many studies suggest doses of 500 to 1,000 millimers per day, something that's difficult to achieve consistently through food alone. We've now reached the factor that most people, and even many doctors, overlook completely, a silent villain called homocysteine. Homocysteine is a natural byproduct of metabolism. At normal levels, it's not a problem, but when its levels in the blood rise too high, it becomes toxic to the lining of your arteries. Picture a fine piece of sandpaper constantly rubbing against the inside of your pipes. This damage accelerates plaque formation, promotes the oxidation of cholesterol, and raises your risk of dangerous clotting. And what does this have to do with vitamins? Everything. The system your body uses to break down and eliminate homocysteine depends entirely on a trio of B vitamins: vitamin B6, vitamin B12, and folate, B9. These three vitamins are the tools that convert homocysteine into harmless substances. If you're deficient in any one of them, the recycling system jams, and homocysteine starts to build up. Older adults are especially vulnerable. The absorption of B12 naturally declines with age, and many seniors are walking around deficient without even knowing it. Food sources are key. Folate is found in dark leafy greens, lentils, and avocados. B6 is found in chicken, fish, and bananas. B12 is found almost exclusively in animal products, which means that for vegetarians and vegans, supplementation is essentially non-negotiable. If there's concern about your homocysteine levels, something checked with a simple blood test, B vitamin supplementation is a highly effective strategy. Ask your doctor to include it at your next checkup. Hidden saboteurs in your medicine cabinet. You may be doing everything right, eating well, moving your body, taking your supplements carefully, but something in your medicine cabinet could be working against you. Let me tell you about two very common culprits. The first, proton pump inhibitors, better known as omeprazole, pantoprazole, or esomeprazole. Millions of Americans take these daily for acid reflux and heartburn, but their chronic use has a little-known consequence. They deplete your body's magnesium levels. These drugs alter stomach acidity in a way that interferes with magnesium absorption. And why does that matter? Magnesium is nature's great relaxer. It helps the smooth muscle in your arterial walls stay relaxed, supporting healthy blood pressure and a steady heart rhythm. If you've been on one of these medications long-term, it's absolutely worth talking to your doctor about having your magnesium levels checked and possibly considering supplementation. The second saboteur might be that nasal spray or cold tablet in your bathroom. Many common decongestants work by constricting the blood vessels in your nose, but that effect doesn't always stay local. They can cause vasoconstriction throughout the entire body. For someone already battling high blood pressure, this can trigger dangerous spikes that put extra strain on the heart and arteries. That doesn't mean you can never use them, but they should be used cautiously and for the shortest time possible. Today, we've unmasked the silent enemy, atherosclerosis, and introduced our team of nutritional heroes. Remember their roles. Vitamin K2, the calcium traffic cop that keeps calcium out of your arteries and in your bones. Vitamin E, the antioxidant bodyguard that protects your vessel walls. Vitamin C, the structural builder that manufactures collagen to give your veins strength and integrity. And the B vitamin trio, B6, B12, and folate, the cleanup crew that neutralizes the toxic compound homocysteine. I want you to leave with this message. There are no magic bullets. These vitamins are incredibly powerful tools, but they work as part of a complete plan. Their power multiplies when combined with the true foundation of heart health, moving your body every day, eating real whole foods, not smoking, managing your stress, and getting quality sleep. And the most important rule of all, this information is educational, and it is never a substitute for your doctor's advice. Supplementation needs to be personalized. Bring what you've learned today to your next appointment and work with your healthcare provider to build the right plan for you. Now, I'd love to hear from you. Which of these vitamins surprised you most? Is there something you learned today that you're going to put into practice? Leave your thoughts or your questions in the comments. I read as many as I can because your experiences teach all of us something. I'm Dr. Leonard Brooks. My mission is to give you the knowledge you need to take control of your heart health. Take good care of yourself, and I'll see you in the next one.